Bene, adesso darei subito la parola al vice ministro della salute dell'Ecuador, Carlos Eduardo Durán Salinas.
Well, thank you very much. I will do my presentation in English. I think it will be easier for everyone here. Good afternoon. My name is Carlos Durán. I'm the Vice Minister of Health in the Ministry of Health of Ecuador. So I will start with just a brief geographic location of the country. You can see this is the map of South America, and Ecuador is in the north of South America, bordered by Colombia in the north and Peru in the southeast, the Pacific Ocean. And it's impossible to see here, but there's small islands. There's Galapagos Island, which is part of our territory. So a little bit about the legal framework which cover our response. You have here three main bodies. The first one is the relationship between the national constitution and the human mobility. Just for your information, we have a new constitution since 2008. It's a little bit more than 10 years that we have this new legal framework, and which actually we think is really the most important body we have to cover our activities. In the relation with the human mobility, our constitution says that people have the right to migrate, and foreigners will have the same rights and duties as any other Ecuadorian citizen. And this probably is the most important part. It is stated in our constitution that foreigners will have the same rights as any Ecuadorian one. The state will protect the rights of people in human mobility and defend the principle of universal citizenship, freedom of movement, and progressive end to the status of foreigner. And people will have the right to migrate, and no one will be considered illegal due to their migratory condition. This is like that in the Constitution. And then what the Constitution says about the relationship between the Constitution and the right to health, and said health is the right guaranteed by the state. So when we say foreigners will have the same rights, and the health is a right guaranteed by the state, then it's easier for us to have a nice framework to put all our activities in place. And then we have the law of human mobility. The principles of this law are citizenship, universal citizenship, freedom of human mobility. Well, the most important thing is equity in front of the law and no discrimination. Yeah, I have that. So these are some of the extra guidelines we have launched, especially for healthcare of people with human mobility. Some of them, no additional procedures or documents will be requested to receive healthcare. Integral healthcare will be provided without discrimination. People who have not regularized their immigration status will not be reported, and confidentiality will be kept, and nationality must always be recorded. This is some facilities to facilitate, let's say, that in some way the care that our facilities are providing. These are some of the figures of the migration situation in recent years, especially with citizens from Venezuela. You have this 2018. These are the number of entries. Some peaks is close to 1 million people in the borders. These are special restrictions on passport requests in Peru. So you can see when the Peruvian government they put some special restriction, you can see how it goes down, and then when they release it again a peak. I will show you what we did in that particular situation, but we have almost 1 million people there in the border. And before explaining this slide, it's important to know that it's also stated in our constitution that health is free of charge to everyone in the country. So you can go to a health facility of the Minister of Health and you will receive help without any money in exchange. That means this is a right, and that right also applies for people in human mobility. These are the figures of from 2013 to the 18. The number of visits of foreigners to the health system run by the Minister of Health. You see that we have a quite important way of Colombian citizens all over the years. Ecuador has a long history of taking care of refugees from the Colombian conflict. But what is particular of this graph is that in recent years, if you see the orange color, in 2017 and 2018, it's really something to be highlighted. The people from Venezuela attending our facilities in the country. That means around 35% of total visits to the system. There is an important fact also to tell you. It's about the measles outbreak we had in the Latin American region, and this is closely related with our health response. In February 2018, we had an epidemiological alert about measles cases in all these countries, but especially almost 1,000 cases in Venezuela. Latin American region was a region where measles was almost free during some years. In March 2009, we released early warning to control measles, diphtheria, and yellow fever. The yellow fever, especially due to crisis in Brazil. What do you mean about early warning? I mean, we did this kind of warnings before having the first case reported, and this kind of best practice. This allows us to mobilize resources, relocate resources, and at the end we implemented a short-term plan to prevent reintegration of these diseases into the country epidemiological profile. I won't talk about measles in Europe because it's quite different numbers. This is a little bit about the results. We implement an alternative vaccination scheme. We asked to some expert committee to advise how we should proceed, and they recommend that every single person coming to the border must be questioned about any proof of vaccination, previous vaccination. If people can't prove that, we proceed to vaccinate this person. So we have special people in the border to control every single migrant trying to cross the border. And if not any proof of vaccination before, then we proceed to the immunization. Then 10 national reference hospitals, almost 40 sentinel healthcare units to perform local point of attention. Our results in 2018, we had 19 confirmed cases, 11 imported, 8 associated to them, and we have final no local circulation of the virus. So it means it was very good, very well controlled, the measles outbreak, at least in our territory. but also we protect the health of people in human mobility. This is our border with Colombia, and of course we have all this kind of movement coming from Venezuela, crossing Colombia, and then we have two controls here and also in the Amazon region. You can see there, we relocated almost 400 healthcare professionals, 2 healthcare units including healthcare provision, epidemiological surveillance, and immunization services opening 24 hours a day. This is located here, which is the main migratory point we have between Ecuador and Colombia. One more here in this province. We provide a screening test for HIV and also treatment for HIV. Actually, it has been really a challenge for us because we have quite some patients coming with different treatment schemes. Nowadays, our experts commission, they updated the treatment guidelines for those coming with other kind of regimes. So for us, it's quite easily for our doctors to change to our drugs within the country. I mean, related with HIV and tuberculosis. And of course, we deliver information at the entrance point. And we supply kits, especially for hygiene and personal health. We have some children coming in really difficult situation and conditions, so we are able to provide at least some food with a lot of how do you call that? Calories. All these activities has been run all over the country. We have the border with Peru around here, so we also have health services around this point and all over the country, especially in the capital, which is around here. But of course, I will not go further on explaining everything about the response. Again, about the peak, this is the humanitarian corridor. This is quite special because this is the first time in the region history in Latin America that a country decides to build a humanitarian corridor. In the most important, in the heaviest point of the rate of people in the border, all these people, they wanted to go to Peru. So we decided to build a humanitarian corridor to assure a safe trip to all these people to the south border. So we have an entrance point here, an entrance point here, with buses. With military safeguards, of course, and with special points to take care, especially from the point of view of the healthcare, and then to bring them to the border, to the migration point with Peru. It's impossible to read, but this is all the resources we mobilized to assure a safe trip to migrants from Venezuela to Peru. This is just a brief summary of what I have said. This is in Spanish. I apologize for that. But this is the number of between 13 and 16, the number of visits to our clinics in the country, and you see the numbers in 2017 and how it increased in 2018. It's quite a lot. And also here you have the money that we have expended to cover all these necessities. You see 58 million in 4 years, 18 in 2017, and 23 just between January and September 2018. So it's really important increase between the previous year, and this is due to the high influx of citizens from Venezuela. I will finish with this one. This is we have in kind of the health organization for Andean countries. In this organization, we have members to Venezuela, Colombia, Peru, Ecuador, Bolivia, and Chile. And this is the space where the ministers of health, they can talk and decide things. So in November 2018, there was a meeting of the ministers in Quito, in Ecuador, and they decided to commission a group of experts on health and migration, basically to write an Andean plan for the health of the migrants, with these main components: resilience of health systems, a strengthening of human force capacities, a strengthening of health information systems, organized cooperation activities, and non-discrimination. Last week, the ministers of Ecuador and Colombia met in the border of those countries and agreed a short-term implementation of a unique health card for people in movement. One of the main problems we had was that people received some kind of health care in Colombia, for instance, but we don't really have any kind of information of the basic vaccinations, of other health care they received there. So it was important, it will be really important for us, and probably the first experience in the region, to have at least a basic health card to share information. Meanwhile, the people is walking to the final destination. This more or less I can share with you. I of course open to questions, and I can't end without acknowledge the invitation of the Global Permanent Forum for Migration and Health, and also the Universidad Técnica Particular de Loja. Muchas gracias también por la invitación. And thank you very much.
Dear Carlo, thank you for your presentation and for your support at our forum. Congratulations for all the work your ministry is doing on behalf of migrants. So, a question. Many Ecuadorians, as many Italians, migrate to the United States. And my thing is, your commitment is also to protect the health of Ecuadorian migrants. And so, did you have any trouble protecting the health of migrants in the Mr. Trump era?
Well, we have to be aware that the immigration to the United States is a quite, we call an old migration in Ecuador. This had a main wave in the 70s. The most important wave of immigration of Ecuador dates to late 90s, to Spain, to Italy, and in that case, what we have performed as a country is to assure a public health insurance in Ecuador to our migrants. But in fact, it's not an easy task. We don't really have information till now what's going on in the United States. We all know that health system in the United States is quite difficult to manage. It's really difficult for me to know what's going on there from this migrants which are already 20, 30 or 40 years in the United States. But in recent years, we had, in the last two decades, we have migration more to Europe, and in Europe we have other kind of health systems, and then therefore I think healthcare is more or less assured for our people.
Okay, thank you.
You showed us in the graph that Venezuelans, as soon as they come back, they really want to go all the way down to Peru. My question is that for economic reasons, because it's better Peru as far as jobs is concerned than Ecuador? Why would they want to go all the way to Peru and not stay in Ecuador, the Venezuelans?
Yeah, that's a nice question. First of all, it's around 50% of people that stays in Ecuador. Of course, we have a strong currency. In 1999, we changed to American dollars as a national currency. But also we have quite a strong labor laws. So in Peru and countries in the south, for instance, you can be hired by 4 hours. In Ecuador, it's impossible. If you want to hire someone, or it's a legal labor, or you have to pay everything. But there's not intermediate point. So of course that it makes it difficult for people to stay in the country. They want to go to countries where it's easier to find a job.
Thank you.
Any question? Okay. Thank you, Dr. Salinas. Thank you. Thank you very much.